Hello everyone, this is Dr. Schroeder with this week's video introduction to week number 4 of our class in Nursing Theories and Professional Concepts in Nursing. And what a good week of discussion we've been having in class. This was a particularly nice week of discussion, I think. There was a lot of different concepts that were covered. All of you have been very busy working on your on your presentations for your nursing theorist. And so the primary task this week was to talk about those 4 meta paradigms in nursing: the nurse, person, health, and environment, and how you define those for yourselves. I've been very very encouraged, interested, and was kind of getting in there and reading along with all of you in the discussions that were occurring. It was if this were a real class, it's one of those classes where the instructor can just kind of sort of sit back with my hands pulled between my head, just listening to students go and talk about all these different concepts. And that's really kind of neat. That's really kind of what the class is all about. So my participation was fairly minimal this week. Not that I didn't give I hope I gave some good feedback and I sparked a couple of good questions and shared a few stories. But there wasn't really a lot of clarification this week. Everybody was kind of sort of picking up the ball and rolling with it, so to speak. And so that's really neat. Several nice little epiphanies out there, several nice comments about how the concepts that are being discussed in class are really helping out. And so I think that that is excellent. That's really what this class is all about. And I look forward to continuing the discussions with you as we move on this week. For week number 4, wrap up one thing about week number 3 is that just to reinforce is that sometimes these concepts of nursing theory can come across as sometimes dry, sometimes difficult, sometimes to even peg exactly what a lot of these different terms mean. And if you're struggling with that personally, if you still, after doing all this reading, if it just sounds like a certain amount of gobbledygook, don't worry about it too much. It takes a while sometimes for the little light bulb to come on or for those little epiphanies to come through. And so don't worry that you're not getting it or that it just isn't making much sense. Eventually, it most likely will to you. And that's not really too much of a concern for me. As long as you understand the basics of what we're talking about at this point, and that you can identify maybe one or two of the theories that sound like they have some resonance with you, that's really, I think, the most important thing at this point. You'll get a chance to discuss that again in your responses to each other in week 4. You don't have a week 4 discussion question. The only real discussion this week is giving feedback to each other on your nursing theorist presentation. So each group, I'm recording this on Sunday, so by Sunday evening, each group should be posting their presentations. Then you're going to go through this week and give feedback to each other. View each other's presentations and give feedback. I will be grading those later this week after I get a chance to review everybody's journals. We'll also be sharing your thoughts, feelings, impressions, and how you interpret and how you internalize these different theories. And so I should have all that grading for you done definitely by the end of the week. I think probably by Thursday or Friday once again. But starting about midweek, I should start the grading for that. And for week number 4, again, you really just have one big paper due this week, and it's your concept analysis paper. I will leave you to review the syllabus, and I'll answer questions as need be. But essentially, a concept analysis is just like it sounds. A concept is something that is, it's very general. It's a very general, abstract statement about something. A concept is by its nature not very concrete usually, and so almost anything that's a phenomenon in nursing can be considered a concept. And so we have listed in the e-reserves a number of concept analyses, and a concept analysis is a specific type of a research paper that goes through and describes and defines from a particular perspective what a particular concept is all about, or what it is, or how it relates. And it can be patient-centered, or it can be nurse-centered. It can be something like pain and pain control is a concept. Good quality nursing care is a concept. Patient and nurse satisfactions are both concepts. And so these are these are terms that can be defined in different ways, and so we've provided for you in the class a concept analysis on any number on several different topics. And your task is to go through and to identify and locate one of these concept analyses and then write a paper following the criteria that is listed in class. And essentially, I think the best way for me to describe this is almost like a topic paper using your concept analysis as a starting point, where you go through and do your own literature search and your own literature review and find as many articles as you can on this particular topic. And then talk about what does this particular what is the current state in nursing about this particular concept? How does it have pertinence to nursing practice? How might you change practice, or how would you suggest a change based on both the concept analysis that you review for class, plus what you find in your literature review? What outcomes would you expect to see with that? In other words, what's going to be the next evolution of this particular concept? And so, in a nutshell, that is essentially what the paper is all about. This is an APA paper. I will remind you that I didn't really give any APA feedback on your journals because your journal isn't really meant to be an APA assignment. However, remember that there are certain conventions that an APA paper must have. It should have a running head on the title page. It should have a title page first. Page numbering starting on the first page, and then just headers after that. Should use headings in your paper. Should always write in the third person, and should not write a personal reflections or share your personal reflections within the paper. It should all be double spaced, 12-point Times New Roman font with references formatted per APA. And so if you have any questions about that, let me know. I can post some APA helps and a couple of websites that can kind of help with that. But at this point, you may not feel real strong with APA yet, so please, if you feel uncomfortable with it or if you have any questions, please let me know. A sample APA paper can be found in the APA manual, 6th edition, page, I believe it starts on page 40 or 41, and you can get a kind of idea what a sample paper should look like. I do not require abstracts, so don't worry about putting an abstract in your paper. That's a question that comes up quite frequently. But you should always have an introduction. The introduction is not, you don't really, your first couple of paragraphs should just be your introduction. You always introduction with a thesis statement or a purpose statement saying why this paper is important or why this topic is important, and then always finish your paper with a conclusion where you go back and reiterate your main points and then just describe how you met your paper purpose. So in a nutshell, that's kind of my 30-second little description of APA. A little bit more complicated than that, probably in real life. But I look forward to giving you feedback and to reviewing those. Again, as you have any questions about the assignment, please feel free to go ahead and post those. Remember that your journals from last week are actually due on Wednesday of this week. I extended that day out because of the you have to be able to review the different theorist presentations in order to be able to really address that particular journal. So I'll be grading that by midweek. And I look forward to participating in class with you once again, giving you feedback on your journals and giving you feedback on your presentations. And of course, participating right along with you in class. So as you have any questions, please feel free to post them. Keep up the great work. Keep up the excellent discussions. And I look forward to seeing you in class.